7 News Alert. Dallas nurse Nina Pham's health improving tonight. Health officials again working to figure out how she contracted Ebola while treating Thomas Duncan, a patient who died last week. Now, the head of the CDC saying this situation may have been prevented if a team was sent to help when Duncan was diagnosed with the disease.
In retrospect, with 20/20 hindsight, we could have sent a more robust hospital infection control team and been more hands-on with the hospital from day one.
And tonight, the World Health Organization projecting that in the next 2 months, there may be up to 10,000 new cases of Ebola every week in West Africa. And with all that in mind, doctors and nurses are focusing on safety here in Colorado. Mark Stewart is live at Denver Health, where new steps are being taken not only to keep nurses safe, Mark, but any of us heading to the ER.
Eric, the point being they want to make sure there's no second guessing when it comes to treating a potential Ebola patient. As we saw late today, new procedures are already being put to the test. Denver health nurse Brian Richard is in training, learning how to suit up in the many layers of protective clothing needed when dealing with an Ebola patient.
It helps us it gets that muscle memory going so that we know, when it comes time to do it, we've gone through it before.
No cases in Colorado, yet doctors say they have a plan in place if a potential patient walks into the ER.
So the first thing that happens is the patient would be escorted to a private room.
A designated list of staff members would be alerted. If it's a true case, the patient would be taken on a special elevator to an isolated unit similar to this.
We are talking to a lot of hospitals. We're fortunate that we have the infrastructure to accommodate this the way we would like to.
Doctors know the public is concerned, yet they don't want people who are in true need of emergency care to avoid going to the ER out of fear.
Patients transmit infection when they are sick, and they transmit only through direct contact with blood and body fluids. It is very unlikely for you to have a risk if you're next to a patient in line, even.
Price would like as many people trained as possible. That includes paramedics. We're live at Denver Health tonight. Mark Stewart, 7 News.